day-to-day challenge, at least I'm not muted. Okay, so it's a real pleasure to be here, and I'm so appreciative to HSE and to PEROSH for inviting me to speak here on behalf of the European Agency for Safety and Health at Work. And we've been working together with PEROSH for, well, since the very beginning, but I really get a sense that in the last couple of years our collaboration is moving to a new level, and hopefully through my presentation you'll also appreciate where the opportunities are as we see them. So what I'm going to do is take you through very briefly what EU-OSHA is, because in conversations in the last couple of days I realised not everybody knows about EU-OSHA. A few words about our new strategy and where we want to go with it. And I would say congratulations as well on the PEROSH new strategy. I think the development of the strategy we found to be a really positive experience. That discussion about what is it we're here for, and how do we actually want to execute that mission, and how can we do it in the most effective way is really important. And so to do that every so often is of great value. EU-OSHA's role is set down in a council regulation from 1994. It's quite an ambitious mandate, and one of our goals was to clarify what it is we can do and what we can't do. And we distilled that mandate into 3 strategic lines of action. So focused quite a lot on the intervention logic, which in itself has a strong focus on the target audience. So in the first place, we're carrying out our research, our analysis, and that's to support policy making and also research. In the second pillar, we've got facilitating the development of guidance and tools to assist the prevention of risks at work. So you can see there we're trying to reach more towards the workplace level, but always through intermediaries. And the third strategic line of action has got the broadest target audience, and that's where we're strengthening networks, trying to act as a catalyst really as EU-OSHA, and also running our awareness raising campaigns, which we maybe presumptuously think are the largest campaigns in the world on occupational safety and health. So that's basically the work that we do. I think you'd appreciate it's quite ambitious, and if you consider that EU is one of the smallest EU agencies, with 65 people, 65 plus one in Brussels, it doesn't seem very realistic. But EU is unique amongst the EU agencies in that it was set up with this network that has a second level network. So every member state has to nominate a national institute, authority, many are PEROSH members, and then at national level to have a network that involves trade unions and employer organisations. So tripartism is through all of our structures. Here you can see basically our strategic, our management structure, how we integrate with the Commission, how we then work on our outputs, and as we're only 65 people, and within that we can only have about 15 actual occupational safety and health topic experts, we rely a lot on external expertise, and that's in many cases PEROSH organisations as either contractors, as members of the focal point network, or more generally in collaboration organisations or collaborations like this one. So I'll briefly run through the strategic lines of action and give you an idea of what we're doing. Under the first strategic line of action, so supporting research and policy making, we're continuing with our foresight, forward-looking studies, which I have to say were originally inspired about 20 years ago in the horizon scanning work that HSE carried out. More recently, collaboration very closely with INRS on the foresight on circular economy. And we've been asked to go back to climate change and address that through a foresight. We're coming to the end this year on a 4-year research-led activity, which we call OSH Overviews, on psychosocial risks, and that'll be disseminated in a Healthy Workplaces campaign that will start next year. We're also halfway through work on health and social care sector risks, circulatory diseases, climate change and OSH, in a sort of more qualitative research approach, occupational exposure to cancer risk factors, and accident prevention. So these either come from, for example, the EU strategic framework on OSH, running from 21 to 27, which sets specific tasks for EU-OSHA, or they're developed in collaboration with the tripartite management board. Those are more sort of qualitative-led type of research activities, although they do include some primary research in the shape of interviews at workplaces often. But then we have another set of activities that are primary research, and they're the surveys. And these number 4 in total now. Our oldest and largest survey, ESSENA, is a workplaces survey. If you like, it presents the company voice, the employer's voice. It asks the person responsible, or the person who knows most about health and safety at work, about what happens in day-to-day practice, what are the motivations, what are the obstacles, how are workers involved, how are psychosocial risks managed. Then more recent, but already in the second wave, is the OSH Pulse Workers Survey, which presents the workers' side, the workers' voice, if you like. The first edition of that was done after the pandemic. It looked at issues related to the pandemic, but also digitalization, psychosocial risks, and we just concluded the second edition this year. And the Workers' Exposure Survey, I think, is another example of good collaboration, because it's a very complex worker-directed survey where modules are designed based on an individual's occupation. So no 2 interviews are exactly the same. And then there's an algorithm behind it based on expert research that estimates levels of exposure. This is something that was developed in New Zealand, carried out in New Zealand and in Australia, and we adapted it for the European context and carried it out in partnership with 6 member states in the EU. And then, at a completely different scale, we carried out a small, quite informal survey reaching out to inspectors in the field through the Senior Labour Inspectors Committee. It was more of a proof of concept, but I think there have been some discussions in the last days about how health and safety inspectors are an important potential source of intelligence. So that was a bit about our strategic line of action 1. I won't go into so much depth on the second one, where we're really looking for examples of good guidance, tools, and sharing them across the EU. I think it's fair to say that in the EU there are very different situations. We have common legislation, we have common standards to adhere to, but there are different needs. And whereas we see maybe in the countries that are more represented in PEROSH, there's a strong interest in the research data, in the comparative analysis, in other member states there's much more of a demand for practical guidance, for tools. And then we take examples like the chemicals tool for small businesses that came from Sweden. Or we developed this heat at work guidance, which we drew on guidance from the UK, from Canada, from the US, and are able then to adapt it to the EU context. And from the Netherlands we took the risk assessment tool, which is, now we have over 400 sector, professional, risk-specific tools with 18 collaborating countries. So I think it's a real example of where we take knowledge from across Europe and share that. The third strategic line of action, when we come to networking and awareness raising, is again strengthening collaboration from participation in the NAPO consortium, which is no longer, to taking contributions in our sort of encyclopedia of OSH, the OSH Wiki, or indeed the campaign that I mentioned, which is a decentralized campaign, and that's the only way that we could really reach as far as we do with the campaign, and the current one is on digitalization. So, having said a little bit about what the agency does, I'll refer now to the challenges, or really the priorities that we need to face from our perspective. And first of all, I'll referred to the key transitions that are identified in the EU strategic framework on OSH, so the demographic transition, the digital and the green transitions. But I think as we've seen in more recent discussions, geopolitics, geoeconomics are playing a larger and larger role. We're being asked how occupational safety and health can be framed in a context where competitiveness is the overriding priority. Obviously, OSH is important for defence as well, but I think we have less of an opening in that regard. And in that respect, with the debates that are going on now at European level around ensuring a fair and inclusive green and digital transition that's fair for all. And the Commission will be presenting, I think by the end of the year, a new action plan related to the European pillar on social rights and also a roadmap on quality jobs. We don't have much details yet. There'll be next week a social summit in Porto, so I'm hoping that we'll hear more details about that there. In her State of the Union address yesterday, President von der Leyen referred to a Quality Jobs Act. So it looks like there might be some moves towards more substantial policy action in the area of quality jobs. And as EU-OSHA, we've been asked to try and contribute, particularly on indicators. And I think that's so important because if it's not measured, it's not done. And the indicators around job quality in the European Pillar Social Rights Action Plan until now have been employment levels and salary levels. No indications of job quality. So there are opportunities, and I think that's why it was so important to see advocacy featuring prominently in the new strategy for PEROSH. So, looking at these challenges in turn, the ageing of society, I think we're all familiar with it as a challenge. But just to say that, according to Eurostat's latest estimations, in the next 10 years, we're going to be losing 1 million of the cohort of the traditionally working age population, 15 to 64. So that's a drop of 5% in the traditionally working age population cohort over the next 10 years. That's really, really around the corner. If we look a bit further back in time, the old age dependency ratio, so the number of workers per pensioner was 4. That was in 2010. In 2020 it was 3. And the predictions are that in 2060 it'll be just 1.5 workers for every pensioner. So that's going to bring some important consequences. One of them is a longer working life. There was a study from the European Pensions Agency just a few days ago saying that already now 1 in 5 European workers are at risk of retiring in poverty. So I was recently in Japan, and I know that there's an employment rate of men over 70, I think it was 43%. And in the surveys, the main reason for working so late was the economic reasons. They didn't have the resources with their pensions to get to the end of the month. So I think this combination of aging society, risk of poverty through pensions, which is affecting disproportionately Southern European member states and Eastern European member states, women are at 30% greater risk of poverty when retiring, is something that we need to bear in mind. Because with a longer working life, of course, we're looking at working with comorbidities, we're looking at just general age-related vulnerabilities. The economy will change as the demands with an aging society will also change. So I think this is a major challenge that has been recognised, but I think there's still room for further analysis. With the green transition, I mean, we've heard great presentations on this in the last couple of days. The way we see or classify it in EU-OSHA is we differentiate those direct risks. So in the second half, where rising temperatures are affecting the spread of diseases and vectors, as we heard timescale. Extremes of temperature, that was presenting just earlier today, natural disasters, uncertainty and unpredictability, this eco-anxiety that somebody asked about today. And then the second type of risks are those related to climate change mitigation actions. So exposure to asbestos when refitting buildings, exposure to dangerous substances in recycling, waste management, or all sorts of new risks related to, or old risks but in new contexts related to, for example, onshore or offshore wind generation, solar panel installation, and so on. Now, I've got some data from our very latest survey, which is not that secret. I was going to say it's not released yet, but our communications department's obviously gone, no, you can't show this. No, it's embargoed. Yeah, great. Aha. There we are. So, the great reveal. 1 in 5 workers say that they're exposed to extreme heat, either indoors or outdoor. 1 in 5 again to poor air quality, whether pollen, dust, or smoke or so. Just over 1 in 10 to intense sun exposure, and 1 in 10 again to extreme weather-related events. Now, you won't be surprised that there are very large differences across the member states. So Greece, Cyprus, Croatia, Slovakia, Malta, it's about 30% of workers saying that they're exposed to extreme temperatures, Norway just 7%. The exposure to air quality issues was highest in Austria, Finland, Greece and Cyprus at 30%, and lowest in Germany at 13%. Not so much difference in the others. The extreme weather event, I think, was highest in Ireland. And with all of these data, I think expressed in bar charts, it looks like it's not so important, just 9%, but we're talking about 20 million workers in Europe. It's big numbers. When looking at the digital transition, we've finished work on that in terms of research, and we're coming to the end this year on our awareness-raising campaign on digitalisation and the risks and opportunities. And you can see the different issues that we've covered: automation, robotics, AI, digital platforms, remote work, and advanced monitoring. And there's been immense interest in this work and in the campaign, and we work very closely with you, led on a lot of the work here. And we've identified fantastic opportunities, not least taking workers out of highly risky environments. We heard just now about the temperatures, working in greenhouses. Obviously, there are also other dangerous exposures. But these automations are representing important investments, and all too often the resources are not there for those investments. And where there's a ready source of cheap labour, then it will continue to be done in a more traditional way. According to OECD figures, non-standard work accounts for 25 to 30% of all contracts in OECD countries, and up to 50% of new contracts. And we know that non-standard employment is associated with higher injury and illness prevalence. So we asked in our brand new survey as well about what actually is digital technology being used for, and I think these are quite impressive levels of penetration of the technology. We're talking about more than 1 in 4 workers saying that tasks, working time or shifts are being automatically allocated, or they have their performance rated by third parties, Smiley, this 5-star rating system, or they're getting automated instructions on how to do their work, or they're being supervised and monitored personally using digital technology. And as you'd expect on digital platform work, it's about double. Looking at what this actually has in terms of effect, so the people who are using digital technology in their work report that in half of the cases it's determining the speed or pace of their work, 1 in 3 or so is saying that they're working more in isolation, or their workload is increasing. 1 in 5 that their opportunities to show their skills and knowledge is decreased. Discretion reduced in 16% of cases, and 1 in 10 saying that their work is losing the meaningfulness. So I mean, I think we can see quite important effects. And this, as I say, will be published in our survey in less than 2 weeks' time. So the final area I'll briefly cover is on the data that we have about the impact on health. What are the outcomes for workers? And we asked about health problems caused or made worse by work. And 37% said that they were suffering overall fatigue, headaches, eye strain, and 35% stress, depression, or anxiety. So those first 3, I think, can reasonably say there's an association with psychosocial risks. And then we have bone, joint, or muscle problems, nearly 1 in 3 as well. I won't go through all of them there. I will mention the mental health stigma. We asked workers whether they felt that if they revealed a mental health issue at work, whether that would have a negative impact on their career, and half of them said it would. And maybe conversely, nearly 60% said they would feel comfortable speaking to their manager or supervisor about their mental health. But what I wanted to mention is that there are enormous differences across countries, which I think gives us some opportunity that things can change. There are different ways that these issues can be dealt with. So, for example, in Greece, Cyprus, France, or Italy, between 60 and 70% of workers say that raising a mental health issue would affect their career negatively. Whereas in Iceland, Sweden, Hungary, or Ireland, it's between 15 to 30%. So really big differences, and I think that would point us to potentially opportunity to learn from each other. We asked about psychosocial risks as well, and exposures there. So 44% saying they're exposed to severe time pressure or overload, lack of rewards for 34%, poor communication in the organisation for 29%, again lack of autonomy. I think again here saying they're the lower end on the bar charts, but if you're talking about absolute figures of workers, there are very high numbers of workers exposed to violence or verbal abuse from third parties, or suffering harassment or bullying. 8%, it's not low for such an exposure. So as I mentioned, OSH Pulse, this is the workers' survey, it's the workers' voice. Just a couple of slides on ESSENA, where we asked the person responsible for health and safety in the enterprise what risks they felt were present, and we can compare a bit over time. And we saw that we've got musculoskeletal disorder risks, prolonged sitting, repetitive hand or arm movements, still very much in first place. Then psychosocial risk related in third place with third party difficulties and time pressure. So some similarities when asking them to when we ask the workers themselves. But ESSENA allows us to investigate a bit more what's actually being done in practice in prevention. So when we asked what preventive measures are being taken in relation to MSDs, we can see the provision of equipment to help with lifting or moving is the most popular. Ergonomic equipment again there in second place. It's not changing a lot. If we're talking here about a gap of 10 years, because the first survey is 2014, so we're not seeing dramatic improvements. It's not enormously encouraging. It's not always the case. I think we also look at how work itself is changing. So employees working from home, we heard earlier about telework increases. We've seen that as well, nearly a doubling in 5 years of the number of employees enterprises saying that their employees work from home regularly. We asked for the first time about consultation of workers on working at home, and very encouragingly, the proportion of enterprises that were covering homework in their risk assessments went from 31 to 48%. So something's working. That's good. I won't go through all of these, but also to say that we can see the representation of migrant workers has gone from 8 to 10%, not much of a change, but the provision of training in other languages has increased more substantially. So there's some sort of reaction there to the needs. The final slide is about the drivers and barriers, and I think that's important for us as practitioners in communication and in the design of measures, because at the end of the day we're relying on employers to put into practice what we're designing and what we're preaching. So it hasn't changed. Still, the number one driver is the sense that the employer has to fulfill a legal obligation. Meeting expectations from the workers or their representatives in second place, very similarly. Avoiding fines from the Labour Inspectorate. The perception of being visited by the Labour Inspectorate is much higher than the actual data from the Labour Inspectorate would show. So there's a real effect. It's not so positive that the motivation of the organisation's reputation is going down. I think, from a communication point of view, we should be promoting the occupational safety and health. It's good for a company's reputation, and likewise with productivity. Maybe more positively, the complexity of legal obligations is decreasing, but again, there are large country differences. Paperwork, bureaucracy seems to be getting easier, but there's a strong lack of qualified personnel to help in risk prevention. So a need to strengthen that area. I will draw my presentation to a close there, but just to say how, again, important I think our continued collaboration is. I think as EU-OSHA we can serve as a conduit to help disseminate the great work that you do to those countries that are not part of PEROSH, and we can also transmit your conclusions to the policy world. In Europe, we've got a visiting delegation of MEPs from the Employment Committee next week. As I mentioned, the Porto Summit is happening next week as well. So the sort of data, the sort of evidence that you're producing is really vital for briefing those European level policymakers. So congratulations on the great work